home care for persons living with dementia. So I'll start with some background information. It's around 8% of the population ages 65 and older in Taiwan living with dementia. And this number will increase dramatically like the rest of the world. And in Taiwan, over 90% of these people living at home and over 50 are solely cared for by their family members. And compared to caregivers of those without dementia, twice as many caregivers indicate substantial emotional, financial, and physical difficulty. And around 60% of them rated their emotional stress is high or very high related to caregiving. And 1/3 of them reported having depressive symptoms, and around 40% of them indicate that their physical stress is high to very high. And in our prior qualitative study, we found that these family caregivers, especially in Taiwan, often facing with different competing needs that they have to take care of their own needs, their children, other family members, their work, and social activity and all that. And like adjusting the children point of the carrying pole, according to the weight of the loads while walking, caregiver has to adjust their priority and efforts among competing needs while going forward with daily life. And our study found that those who can find the balance between competing needs have better care, receiver caregiver outcome, and less impact on the family. So assessing caregivers' perceived sense of balance can help to identify those at high risk for low stress and depressive symptoms, and also intervention to enhance caregivers' perceived sense of balance between competing needs may provide a strategy for reducing the negative effects of caregiving. So based on this notion, we developed the smart close assisted home nursing and to facilitate balance in family caregiving. So the original smart clothing involves embedding various sensors into the garments to enable real-time health monitoring. And these sensors can track metrics like electrocardiogram, heart rate, gait posture, sweat, and body temperature. And by utilizing conductive fabric and smart clothing, establish a healthcare platform. And to cater to the needs of the person living with dementia, the prototype have been specifically modified with front opening vest for ease of wear. Coin-sized sensors are placed in inner pocket to prevent accidental detachment. And additionally, different color, fabric, and materials are used to suit various seasonal needs. So you can see that the smart vest and the sensor will install in the house, and the signal will be sent to the family caregivers, then to the nurses, and then to the family caregivers. And so our research team developed a smart home care model by combining smart clothing technology with home nursing intervention, offering comprehensive support to family caregivers. And in the study, to simplify device usage and meet the home care needs of those with living with dementia, as well as to reduce the battery consumption, because that is a challenge when you administer intervention at home setting. And so the smart clothing in the study was utilized to detect activity level, daily steps, movement, position, posture change, and nighttime awakening without monitoring heart rate in our study. And the person living with dementia was asked to wear the vest 24 hours a day, 7 days a week, and for 6 months. And through data collection, smart clothing continuously gathering activity and position data, and system identify patterns and detect deviation from normal behavior of this individual. And if the activity level of this person deviate from his or her norm, indicating possible emotional or physical issues, and the system would immediately alert home care nurses. Caregiver then receive immediate notification by home care nurses about the potential risk such as abnormal activity level or unusual increased nighttime awakening. So early detection allows for timely intervention and serves as a reference for care planning. And so this is the first visit that the home care nurse made to assess the environment and draw the floor plan and to indicate that the sensors be installed on the front door or the bathroom or the living room. And then the engineer made the second visit because every household is different. Some are very complicated. And then the challenge will be adjust the sensitivity level according to each individual's gait because everyone is different. And so the ID indicate different individual, and then we have to adjust the sensitivity level to each person's situation. And the challenge will be how to recognize the lifestyle pattern of the individual over a period of time, and how to detect any significant or trending deviation from the baseline that we can alert the family caregiver. And this is the APP of the home care nurses. They have case number, and then after the assessment and the data from the machine, we identify nursing problem such as insufficient activity and all that. And then related health education material will be sent to the family caregivers, followed up by phone calls. Okay. And so there are some specific features. It's older person friendly and enhancing caregiver balance because decrease their stress for constant monitoring and continuous monitoring to establish daily pattern, early detection of potential problems. So it will be provide them the reference for taking proactive caregiving strategy than just reactive to the situation. And the sensitivity and alert threshold was set individually and can activate the home care, home nursing intervention. So just briefly talk about the results of this study. We use a randomized control trial and 30 subjects in each group, intervention and control group. Follow-up time is 6 months. And sorry for the small letter, but for the characteristic of family caregiver, it's comparable between intervention and control group, except the living arrangement. So we further control that in the outcome analysis. And for characteristics of person living with dementia, it's also comparable between intervention group and control group. And you can see that most of the person living with dementia were mild or very mild, CDR at 0.5 or 1.0, and have the diagnosis of Alzheimer's disease. And so in terms of the results, those received the smart close care has consistently higher felt balance between competing needs and consistently lower depressive symptoms compared to those receive the usual care. So in conclusion, this home care is able to, seems to be able to improve caregiver balance and reduce their depressive symptoms longitudinally. And it combines continuous monitoring, algorithm-supported insight, and real-time feedback and for their proactive caregiving planning and strategy. And it demonstrates a promising technology-enabled approach for supporting home-based dementia care. And so these are our related publication and our acknowledgement to funding agency. So thank you for listening.